Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello.
Hello, everyone. Welcome to the Soft Bites podcast. Hello, Jorge Andre. How are you?
Hello, I'm fine. This is the first one that we are recording in the morning. I think it's a good habit to keep
Yes, we usually
because
record
we are fresher.
in the night after work, and now we are trying this new schedule. I actually prefer it. I'm more of a morning
Yes,
person nowadays. I used to be
same as me.
a late nighter.
I think it's called getting old.
Yeah, but now I'm more of a morning person. Today we're going to talk about something that I think that many dental professionals complain about. I hear many dentists complaining about working in toxic dental clinics, so dental offices with toxic work environments. Do you
Yes.
have the same complaints about that?
Yes, we have the same complaint. I mean, I have the same complaints. I can eventually say, well, the environment in my practice is not toxic. I mean, but I'm not the one that should be saying that because that it might be. I'm not aware of. I think there's always a little bit of toxicity in every team because once there are humans, and especially the more humans that become part of a team, the more likely it is to have some sort of toxicity. I mean, and I think we have to accept these things as part of human nature, right? The problem is that when it gets excessively out of control, or when it starts to influence negatively our own well-being and the well-being of others, right? But I think that, and we've mentioned this a lot in the past, that dentistry has many components that can make the environment toxic, and it's very easy to create such an environment, especially if you are not aware of what's going on, and if you're not conscious, and if you
Mm-hmm.
don't take some action, and especially if people don't talk about
Mm-hmm.
don't
Mm-hmm.
talk
Mm-hmm.
about the situations. Yeah, but
Mm-hmm.
I'm
I think.
you've mentioned me to me many times that you have many clients that complain
Mhm,
about that,
mhm,
right?
yeah, but I think that what you said is very important. That the fact that there's always going to to be some kind of uh, problem or toxicity, if you want to call it, in work environments. Not only in dentistry, of course, but dentistry has this a lot of this components that we talk always about, that in fact can be a melting pot and
Yeah.
for toxicity. But one of the answers to fight it is to really pay attention, to really want to make your environment a little bit healthier. And I think that when I started working in dentistry more than 20 years ago, that was not something that you talked about. I mean, the even I think I already mentioned this in the podcast. I worked in places in the beginning that
Yeah.
the gossip and the drama was a big part of the job, and was even cultivated by the practice owner.
Yeah.
Because, and I think that's one of the main things sometimes why dental offices have a toxic environment. It's because there is dysfunctional management. So dentists
Yeah.
are trained in dentistry and not in
Mm.
management, and sometimes this when you have a dysfunctional management, this can happen.
Yeah.
But nowadays things are changing, and I think that we start to pay a lot more attention to the work environment, and we start to have more tools to fight this toxic environment. So let's talk a little bit about this. Why do many dental offices continue to have toxic work environment, and how we can, for example, how can someone spot a
Mm.
toxic dental office during a job interview, for example. So if you go to apply to a dental clinic that is asking for dentists, there are some signs, some questions that you can maybe make in order to be able to spot if that work environment is a healthy work environment or a toxic one. So let's talk a little bit about this. What do you think
That's
about
that's
what I said? Let's talk
that's
about this
interesting.
dysfunctional management, because we talk about
Yeah,
a lot of this in our conscious leadership course. I think that's the
yeah,
main thing that we want to achieve with our conscious leadership course. It's a healthy work environment, right?
yeah. Both ways,
Yeah.
which is
Hmm.
not only for the practice, because I think that when the manager creates a good working environment, the manager also benefits from that. Because sometimes we see a lot of people complaining, of managers complaining, oh, uh, patients are not the issue or are not the main issue. The staff is the main issue. This is a very common thing, and this creates a lot of stress in the managers themselves, right? It's very frustrating. So I think that this works both ways. The more you give to the the more the more positive the environment is, the more you will benefit in terms of peace of mind and a fulfilled activity. I was taking some notes of what you were saying, and I think that we have two two situations here. First of all, is prevention, and the second one is treatment. So treating a toxic work environment, it's going to be a little bit tricky, but preventing it, I think it's the best way, right? And sometimes it's too late to prevent it, so you have to treat it. And treatment can be a little bit more difficult. And then you also mentioned how to spot it. Well, so what you are asking is, if you are a dentist that you are going to a job interview, and you want to eventually ask some questions to see how healthy the work is. I think that you should look for cues. You should look for clues about that. And the clues can be the way that the staff is treated, if they are treated with respect, if they are not treated in authoritative way. And sometimes, it's not what you say, is how the way that you say it, right? So I think that if you go to an office for an interview, and if you believe and if you feel a lot of tension there, that's not usually a good sign. If you see that the way that the doctors treat the nurse is very authoritative, is not empathic, and I think there's something probably wrong there. Questions that you may eventually ask, well, let me think, but you may eventually ask, you may I don't know if going straight to the point is a
I
good
have,
strategy.
I
Yeah,
have,
but
I have,
tell me. Yeah.
I have some. So, for example, asking why they are hiring. So I think that
Okay.
will tell you a lot, because sometimes it's just as simple as the practice is growing, right?
Mhm.
And they need another professional in order to
That's
grow.
interesting.
Um,
Mhm.
or it's because the other dentist that was there left, and then you can ask why they left, and and
Yeah, a good
you
one.
can
Yeah.
ask that because if a practice has a high turnover of
Yeah.
positions, or so if dentists are
Mhm.
always coming and leaving, coming and leaving, then that's a
That's
red
not a good
a red
sign.
flag. So ask
Yeah.
why the previous professional left. And also, it's very important when you make these two questions, why they are hiring and why the previous professional left, to
Mhm.
see if the person that is interviewing you starts to say bad things about the other professionals.
Oh, yes, that's
When,
a very good one. Yes.
so when they start saying
Yeah.
bad things about the other professional, like they didn't want to work,
Yeah.
or the work that they did was not criticizing in a bad way, in a negative way, the other professional, that
Yeah.
also is not a good sign.
Those are very good ones. Yeah.
Mhm. I
Those
think
are very
that
good ones.
also it's very important in order, and this is just not, of course, to spot the toxical dental office, but in order to make things clear, that you should ask about production, about what is expected from you to product.
Nice. That's
You
a good
know,
one.
because there are some practices that are very focused on production, money wise, right? And that might be not your one of your values. So in order to align your values with the practice values, I think that's very important. And also,
Very good.
for example, the time the appointment time schedule, how much time you have for
Mm-hmm.
a feeling, or for an endo treatment, because um in
Very
order
good.
to know
You know
if
something? I think that, sorry, so I
Mhm,
think that we should also record a podcast of how to do on advice on how to what to say and what to ask on an interview as a dentist.
mhm,
That's a very good one. Yeah, but
mhm,
sorry, go on. But go on. All these questions, I think they are very important
mhm,
because
mhm,
not only they will provide you information that is very important because you want to know what is exactly expected from you, because sometimes people are not clear, but it also gives you an opportunity to witness the way that people answer these questions, and if they are open to answer them, if they become defensive. I mean, if you ask a question like
mhm,
what is expected from you is in terms of financial production, is it my attitude, what are the practice values, and if
mhm,
you ask, for example, what are the practice values, and the person does not know what to answer you,
mhm.
this is not a good sign.
Yeah, that's it. That's it. Because remember the other time that we talked about that your team is not your family. So, and
Yeah.
that you said no, it's not your family, but you should have you should share the same purpose. That's what will guide
Yeah.
you. So this is very important. If the practice doesn't know, if the person that is interviewing you doesn't know the practice values, that means that can be a sign of what we were talking, that
Yeah.
of a dysfunctional management. So that's
Yeah.
also a red
Yeah.
flag. Yeah.
Yes.
And I think that questions like, for example, what is the protocol when there is a cancellation of a patient? You
Nice.
know,
Nice.
that will show you if the practice has a good system in place. That you can also ask if
Mhm.
the practice have a system in
Do you
place.
have
But
systems?
questions
Do you
like
have a
this
manual? Yeah.
will show you, because it's situations like this that create that drama, that gossip in the practice,
Yeah.
right? What is the
Yes.
protocol when you do a treatment that a colleague of you already did, when you repeat the treatment from a colleague? Because
Nice.
when um, I have complaints of a toxic environment in the dental practice, one of my first questions, I think I already told this in when we talk about several situations here on the podcast, one of my first questions is always, do you have a protocol for that
Yeah.
situation? So when you
Yes.
make questions like this in an interview, that will immediately let you know if there will be drama on that situation, or if the practice is has the tools and to deal with that situation,
Yes, absolutely.
right?
And I was thinking about if this can fire back to you. So what I see while you were talking about this, and I was thinking, okay, for some managers, while they are doing this interview, if they hear all these questions, they will be defensive. And so, if someone comes to my office and does these questions, I mean, I would pretty much be able to answer them all because I mean, I've got burned enough to be able to prevent these things. But I think that on the average dental practice, the manager might start to be, wait, what is this? Where is this person trying to go? I mean, these are too many questions for my taste, so I don't think this is a good thing. Okay,
mhm.
so I'm just
I
thinking.
get it. So you think that the dentist will be put aside because no, he's
It's too picky.
yeah. Okay.
I'm not saying it will be. I'm not saying it will be. I'm just saying that, and this is why we should record a
But
podcast on
you
this.
still
Really,
think that nowadays that not still
no.
this
I
is
think that it's not only the questions that you do; it's the way that you do them. Uh, I would probably say something like, "Okay, do you feel comfortable? Is it okay that I can ask you some questions regarding the the um, the way that you work here? Is it okay for me to ask some of these questions? Because I would like to know if this is actually not only a good fit for you, but also a good fit for me, because this is a place I came here because I consider this place. And by the way, before you ask these questions, you should also show that you have done your homework. What do I mean by this? You went to the website, you know the team, you know what they do, and you should show that that you did your homework and you did some research before you came there. So that's
mhm,
one thing, and then you can ask these questions, right? But
mhm,
I
mhm,
think that we should leave this for another podcast because this is very interesting. Now,
mhm.
I'm also now thinking on the manager hiring. Okay,
Yeah.
I'm going to
Yeah,
tell
yeah,
you
yeah.
what I do. I'm going to tell you
But
what I
look,
do. Yeah,
if you are because what we are trying here with these questions is to spot the toxic dental
sure, sure,
environment,
sure,
right?
sure.
And
Yeah.
if you are a manager or a dentist slash manager,
Mm-hmm.
right?
Mm-hmm.
That is and you might not even have a system in place yet, but that is worried about creating a healthy work environment. And if you find these questions strange, I
Mm-hmm.
think that when you already have this awareness and you want to create a healthy um, a work environment, you already changed. You know, your shift is all already in curiosity,
Absolutely. Yeah.
and you can ask, oh, that's interesting. Why are you asking this? You know,
Yes.
and
I think these questions, they should be asked. I
mm-hmm,
think they
mm-hmm,
should be asked.
mm-hmm,
I'm
mm-hmm.
just my feeling is that most practices are not ready for this.
Mm-hmm.
This is the way I feel.
Yeah, yeah, yeah. I understand. But look, for example, I've been talking with a lot of dentists that, for example, in France, and it's starting to be also in other countries that one of the questions that they are starting to ask when they go to a job interview is, will sales be a part of the job? Because in some
Okay.
practices nowadays, it's expected
Hmm.
that every patient should leave uh, with the dental with
Treatment plan or
treatment plan
yeah.
sold, and that's
Yes.
sales.
Yeah, absolute. That's not dentistry. Yeah.
So,
Hmm.
but there are some dentists that are very good on sales, you know,
Absolutely.
and that align with their values.
Sure. Sure.
But
Yeah.
if you are not, then you have to pay attention to this
Yes.
because
No,
this is important also.
I think I'm all in for this sort of questions. I'm all
Hmm.
in. I just the only thing that I should think, like in every interview, you should get yourself ready, and you should show that you have done that you are also being aware of the fact that this number of questions, it's not like you go there and just shoot all these questions,
Hmm.
right?
Yeah,
You
yeah, no,
just
of
need,
course not.
yeah, yeah.
No.
You need to create some empathy, and you need to be and you need to do your homework, right?
Hmm.
This
Hmm.
is what I believe. But for sure, I think, and this is why I think it's so interesting that we should record something specific on how to behave on or what to do on an interview as a dentist, how to do on an interview. Now, from my perspective, I'm going to tell you what I do, and this is I never thought about why do I do this. I mean, I've thought about, but I think it fits on what we are talking, which is whenever I have someone that starts to work with me. For example, I have a new dental hygienist, the second one that started to work with me, and I always tell them, look. you are talking with me. This is this is and I gave them the link for the manual, and I said, look, these are the critical parts that you should read as soon as possible, but you should read everything, and you should also contribute to it whenever you think it's possible. But and I always tell them, and also after the interview, I send them an email with the resume of what was talked and what was agreed on the interview. So it is written because sometimes I might forget, oh, I'm going to pay you this and this is going to be your schedule. So I always send them a summary. But more important than that, I always tell them this, and I think they're going to find this interesting, which is this is what I talk so far is the way that I see my practice. But I don't think I am the most neutral person here. So I would advise you to talk to the other nurses and the other colleagues. And this is very important because I want you to know from an outside opinion what exactly it feels like and it is working here. If it is a nurse, I want them to talk to all the nurses. If it is a doctor, I want to talk to the nurses and to the doctors. Please call the other hygienist and ask them and talk to her how it is exactly working with me because there are some of the things that might not be easy for you. And I tell, look, I am a demanding person. I'm not. I will never be disrespectful, of course, but I am a demanding person, and the best way is for you to talk to other people that work here for longer periods, and they will have a much more unbiased opinion of what it is working with you. And I think that when you say that, you are placing yourself in a very vulnerable situation, but also you gain a lot of trust from the people that start to work with you because they understand, look, this is trying to be as honest as possible, and if there is something that happens here in the practice that he's not spotting that can happen, right, I'm going to find that out, right? So I think this is a good tip, of course, if you have done if on the side of the manager, if you have also done your homework, which is having systems and thinking about these things.
Mm-hmm.
Yeah.
Mm-hmm. 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 Yeah.
And this is something that I think it makes a big difference on the
Mm-hmm.
on the
Mm-hmm.
on the trust that you create. And also, I always tell them, look, uh, we have you have an experimental period, and you work here for 1 month, 2 months, 3 months. At any time, if you believe this is not a good fit, it's fine. There's no pressure, but if you believe it's a good fit, then we are more than welcome. And I
Mm-hmm.
think this lowers the expectation. This lowers also the drama, etc. So I am basically trying to send them clues that they should feel comfortable here talking to other people about exactly what
Mm-hmm.
is going on.
Mm-hmm.
Yeah.
Mm-hmm. 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 Yeah. Yeah, and I think that for a toxic environment, we already talked about a lot of, because that's what we talk a lot is about healthy work environments and
Yes.
dentistry.
Yes.
So
Hmm.
I think that things like a dysfunctional management, we talk a lot about that, about how
Yes.
dentists are
Very
not prepared to
typical.
be
Yeah.
managements. And when you do that,
Alpha
sometimes there's
nurses.
yeah, continuously being short-staffed, because there's a lot of dentists
Yes.
that still work with nurses that work several hours more than they they
Yes.
they they should, and there's this exhaustion of the staff.
Yes.
So that's also a thing that contributes to toxic environment. The lack of appreciation and or sometimes disrespect. So we know that we have some authoritarian leaders, some dentists or
Sure.
some management lead with not with empathy or with compassion. So sometimes
Hmm.
there is even disrespect, and we
Mhm.
know that in dentistry it's very easy to forget about the successes and only look for the mistakes. So lack of
Sure.
appreciation, don't forget to show appreciation. Also something that we talked about in a previous episode. So when there is favorites, when there is
Yes.
sometimes discrimination. So that's also contributes for a toxic environment. And the thing that we been talking about protocol. So when there is a lack of clarity around the practice
Mm-hmm.
organization, and even the practice goals, even a vision for the practice. When there is a lack of clarity around this, then this will lead, of course, to a dysfunctional management, and this will contribute for a toxic environment. What do you
It's
think
it's a
about this
it's a
summary?
melting pot. It's a melting pot,
Yeah.
and on top of that, the stress of the patients,
Mm-hmm.
the shortage
Mm-hmm.
of staff, and in
Mm-hmm.
dentistry, I think that maybe you have a clearer view on this than me because you were saying stuff like everybody wants to be into sales, and I think this is something that sometimes I am not aware because I work in this microcosmos, which is my practice, that I try to make it in a certain way. And sometimes I forget that there's a lot of pressure today to do fast, to sell, and this
There's a
creates
lot of
also a lot
pressure
of
today
pressure.
to sell.
Yeah.
That's what I've been since I started the mindful industry, and until now,
Mm-hmm.
the major shift that I see is this
Mm-hmm.
pressure to sell.
Yeah. This is also a
Hmm.
good thing for a podcast. This is the pressure to sell. That's another thing. Yes. Yeah.
Hmm.
And I was thinking here, taking some notes about what I mentioned before, which is prevention versus treatment of a toxic working environment. Prevention, you've talked about that, which is systems and meetings, systems and meetings, systems and meetings. And when we talk about systems, we are also talking about values, about discussing values, about what is the direction that the practice, who do I want to be as a leader, what kind of environment do I want to create. So when we talk about systems, basically we are talking about vision. That's it. On a more macro and on a more micro. So systems is critical, and we talk a lot about this. Not only systems, but meetings. And when we talk about meetings, we talk about bidirectional feedback, which means that you need the people that work with you, they need to understand they can also influence the systems themselves and they can be heard. And meetings, we are talking about the one-on-one and the praising, which is important, and the meetings with all the staff and the meetings with all the doctors. So there's a lot of that component. This is in prevention. So now, treatment. Here, and I'm sure that you have probably way more experience than this than me, because I'm sure that you have students that are inside a big mess, whether they are practice owners or they are just associates. And here, when it comes to treatment, what is your experience? I mean, you have a student that is on a mess, whether a leader or an associate. So where do you start?
Well, you have to make an evaluation. You
Yeah,
have to make an
diagnose. That's good.
evaluation. You really have to make an evaluation if because there are certain issues or
Hmm.
problems or challenges that are on your side that you have to take responsibility for.
Whether you're
Mhm.
an associate or a leader, right?
Yeah,
So
there are.
you have to look. So first of all, see if the problem is not you,
Yeah, that's it. That's it.
because it
Uh,
often is, especially as leaders, right?
yeah,
Because
that's it.
leaders have higher responsibility.
Hmm.
Let's be honest.
and and then you have to really see what is the problem, and if there is some action that you can bring to the problem.
So
So
give me an example. For example, you have a student that is an associate, okay, and he complains with you about an alpha nurse. So what advice do you give to that student?
you have to, I mean, like you said, most of our answer here is about communication. Even a toxic environment can be defined as an environment where you don't feel safe to
You
communicate.
communicate. Yeah.
Yeah. So you have to be
Hmm.
able to, you have to see if you can talk to you said an associate, right? Or the practice
An
owner.
associate, an
Yeah.
associate.
You have
Yeah.
to be able to, you have to see if you can talk with the practice owner about
Mm-hmm.
this person always first,
Mm-hmm.
and then you have to talk with this
Yeah.
person. You have to see
Mm-hmm.
if there are some kind of change. If you for example, on that, I think I talked about this example, the example of someone just barging into your
Yeah.
cabinet without knocking or anything, right?
Yeah.
After you talk to the practice manager, after the practice owner, after you talk to this person, you have to be able to see a change of behavior,
Yes.
because otherwise,
Mm-hmm.
if there is not a change of behavior, then the problem continues. So that's
Yeah.
what I was saying. First, you have to do an evaluation. Then you have to be able to see the actions that you have to take, even if it's small steps, but the actions that you have to take to lead you to a different behavior. You take those steps, and if the problem is solved, if there is a different behavior, okay,
Or
that's
at
good.
least there is an evolution. At least
Yeah,
there are things are going in the right
that's
direction.
it.
That's positive, right?
But there are
Yeah.
but if there's no change and you continue to feel that you are not safe, that you are still not heard, or if those behaviors have a negative impact in your life, then
Mm-hmm.
sometimes you have
Decide to
to
leave.
leave.
Yeah.
Or if you
Yeah.
are the practice owner, then that alpha
Yeah.
nurse might have
To
to
leave.
go.
And let me ask you another question. So let's imagine you are now a leader. You are allowed. You have a practice, right? And you have a practice, and you just think you believe that things are out of control in terms of gossiping, and this doesn't lock this doctor does not like that nurse talks bad things about the other. You just believe that it's the toxicity is rising there, and everybody, or there's a bunch of people that talk bad things about the others, and things just start to not be very comfortable, which is very common, right? To a practice leader, how do you think they should approach the situation?
But that
First of
has
all, first
has a
of all,
lot to do with going and learn about management. Eh? You
yeah,
have to know to have the techniques. You have
yeah,
to have the
absolutely,
techniques. You
yeah,
have to go and learn about management. You have to, if you don't have a protocol in place, you have to go and look
yeah,
for a good system. You have to be, and you have to have help to implement. You have to bring your team on it. You have
yeah,
to have the communication skills for it. So it's just
yeah.
that, for example, a simple exercise that it can be done. It's monthly. Uh, the assistant and the doctor, they write three good things about working with the doctor, and three bad things about bad things. Was critic, positive
Mm-hmm.
and negative, and the same
Mm-hmm.
thing the doctor writes about the assistant, and they have the
Mm-hmm.
meeting to talk about those things, and to be able to work together and to be better together.
Yeah,
So, but these are tools that are taught. You have to learn about them,
yeah.
and
And
sometimes you need help implementing them.
so the first thing is what you just said, which is if toxicity is out of control in your practice, whether you like it or not, there's a big part where it is your own responsibility, right? So
Yeah,
you also have a responsibility, and I think this is a very clear message that we have
you
to give to
always have to
leaders.
make the question, am I the toxic one?
Yeah, if first, yes, you actually,
Yeah.
because if you talk bad about other people, you can expect that, right?
Hmm. Hmm.
But I think it's
Because
important that we
nowadays,
realize, yeah,
George and Andrea, nowadays toxicity goes even a little bit further than that. Because nowadays is not only talking bad about people. If you are in a group and you are listening to someone talking bad,
absolutely bad,
you are
yeah,
an accomplice of that.
absolutely, yes,
So
yeah,
nowadays it's not only the one talking bad. Is
yeah, yeah,
because nowadays you say, but I don't, it's not me talking. Yeah, but you are there and you are participating on
yes.
it.
Yes, and you have to make it feel that sometimes in some meetings, I think it's good. Look, I don't feel comfortable being in a meeting where we are talking bad things about people that are not here, and I think you should impose you should also be able to impose
Mm-hmm,
those limits. Yeah,
mm-hmm, mm-hmm, mm-hmm.
but you always have as a leader, whether you like it or not, there is some sort of responsibility.
There's an
You are.
impact. You have an
Yeah,
impact on others, and you cannot
yeah,
neglect that.
yeah. Yeah,
You
you have to
cannot
be
neglect
aware
that.
that happens for a reason, and probably it happened because there were no preventive measures in place,
Mm-hmm,
right? So you have also a responsibility in that. And I know, this is very tough to hear because, for example, when I hear this, and of course I am responsible for many things that don't go right in my practice, and when I hear this, what I feel like is like, oh, but there's just so much going on. I have to work on this. I have to work on that. I have to see patients. I have to this. So why can't you all just be? And this is a very typical complaint of managers. Why can't you just all be grown ups, right? And the answer is you cannot expect that to be
mm-hmm.
spontaneous in a
You
team. You have to create
just
an
out of
yeah.
curiosity, I usually have 13 questions, a questionnaire. It's not mine, but of for you to answer the question, am I the toxic one? So, and if you answer yes to any of the questions, if you identify with this
Yeah.
behavior, I'm just going to read you here the first
Okay.
one.
Yeah.
So,
Yeah.
first, do you indulge in gossip? Two, do you make negative
Mm,
comments about patients or coworkers? Three,
I sometimes, yeah, sorry. Sometimes I make negative comments about the patients. Sometimes
do
I do,
you
and I regret that. But it's very rare. But I know. Let me give you an example. I knew this. Oh, she's
But
just
this
a
is not
pain
for
in the
critique.
ass.
This is just for self-awareness. So
Yeah,
this
yeah, but
this questionnaire is
absolutely.
used for us to think about
But the
our
problem
behaviors
is
because sometimes
the
we
problem.
do them and we're not aware.
Yeah, but the problem is that fires back. You
Yeah.
know how it fires back? Is that then you listen that the nurses sometimes they talk bad about other patients.
Yeah.
And you know why they do that? Because they've heard me talk about bad things. I mean, it's not terrible, but it's sometimes they come to, oh, she's such a pain in the ass, or she just always comes late, and this fire propagates. So yes, yeah. But go on. Sorry.
Yeah. Do you look down on others? Are you always in a bad mood at work or negative or critical? Are you happy when something negative happens to a colleague? Do your colleagues avoid
So
you? Are you
mm,
unwillingly to help other people or to withhold information that could help them?
no,
Do you like change? Do you ask for solutions only to tear those solutions down? Do you witness unacceptable behavior and don't speak out or don't report it? So it's not only about you, it's also about noticing something and
yeah,
just
and not
staying
doing
quiet
anything.
nowadays.
Yeah. No, but those questions, if you ask these questions to any management in a dental practice, they are going to be uncomfortable questions because I am sure that there's going to be they will start to be aware that actually, well, there's way more to do that what I need to be much more active about this
Mm-hmm, mm-hmm,
than I am. Yeah,
mm-hmm, mm-hmm,
and yes, it's true. It's you there's a lot of things that you need to do to prevent things from happening,
mm-hmm,
and some
mm-hmm,
of those things they demand action from you, and this is why it's so difficult because on top of that many of these managers they are also dentists,
mm-hmm,
and they work a lot, right? They don't usually don't they don't have specific time to allocate for these questions or to develop themselves or to stay calm and to because you really need to be a high performer to be able to answer these questions or to answer most of that if you want to be able if you want to be in a position that you are going to answer all of those questions and
mm-hmm,
feel proud of yourself, it's very difficult. It's
mm-hmm.
really difficult. It's like a full-time job. it's like a full-time
Yeah,
job.
but recognizing our behavior, it's the first step in the
Yeah.
process of change, you know. And I think that also, and you ask what can be done, I think that making this shift of curiosity instead of being right is a
Yeah.
huge also solution, because sometimes what you see in a dental practice management is the being right mentality. Okay, it works, I do it this way, so you should do it this way. So
Yeah.
and it's a lot of ego there, right? We talked about
Yeah.
this, the ego in the history, right? Proving
Yeah.
ourselves right.
Right.
It's even the some believe that it's the key to survival in this dentistry world.
Yes.
So
Yeah.
it's, if you shift this to curiosity, it's it really changes, and it's not difficult for dentists because dentists are curious, and their mind is curious, but somewhere along the way we forget about that. But it, it's a lot of making the shifting, and by shifting you can act out of curiosity. So what can I learn from the situation? Why am I feeling this way? Why is the situation making me feel uncomfortable? How can I see the situation from another perspective? You know,
Yeah.
because if you think about it, when you react on being right, you want to control, you want to stay in control, you want to
Yes.
protect yourself and what is yours,
Which,
right?
but in life there is no such thing as security.
Yeah, yeah, that's it. And
Yeah.
some one of the situations that I always talk about when I go to a dental practice is the meeting after the meeting. There's even a sketch that I have about that, because sometimes in dental practices there are indeed staff meetings that happened,
Mhm.
and someone talks, or the owner talks, or the manager talks, and they say to and I want to listen to all of you, and no one says anything, right?
Yeah.
And then after the minute that they go out, then they trash everything that was told on that meeting. So this
Yeah.
is the meeting after the meeting that usually happens in dentistry, and this is also a trace sometimes of a toxic environment, because there's there's not a real communication. And there are exercises that you can learn how to do it. You can, because sometimes people don't know how to talk, that the environment might even be safe for them to talk. That's not the point, but they don't know how to. That's the way that they are used to talk, just by the gossiping and the drama. So you have to direct them, and to be able to create that channel of communication, you know.
Yeah. Yeah.
So yeah, this is the main thing is really activate the curiosity, make yourself those questions, see if you are only trying to be right, to control the situation that cannot
Yeah.
be controlled,
and
like
and
you
and
are saying.
and doing self work to
Mm-hmm.
feel it is okay to be wrong, and it is okay to say, well, actually, you are right, and there's a different way of doing things, and trying to learn from that. But yeah, it's not an easy,
No.
task for most leaders, especially if they being if they are used to being a certain style for so long, which is okay. So this is the way that I've always treated my staff, and there's no way I'm gonna go back, because it seems like I'm losing it's I'm losing what I've conquered so far. It seems like it's a very personal attack. Oh,
Mm-hmm.
what you are saying, that what I've been doing so far is not good, but look at what I have achieved. I've achieved this and that. So there's a lot of inner work that you need to do, and especially even for myself, that I think daily about these things. There's just so much that I believe that I should be better, especially when I'm doing this podcast, and when I reflect on it. Well, actually, there's when you were asking all these questions, I said, well, this is going to be easy for me. Well, it's actually not. There are a few of those. For example, talking bad about patients, that sometimes I do. Most of the others I think that was okay, but there are just a few that I think that I should. There's a lot of things that I can eventually that I could eventually evolve. Yeah,
Mhm.
but yes,
Again,
that's
it's not a critique, and for the ones
of
listening,
course,
it's not a
of
critique. It's
course.
just these are exercises to for you to start being aware of your own behavior. And even
Yeah,
the if you go to a management course, and or if you go to our course, a lot is
yeah,
about self-awareness, is because you
yes,
for you, in order to change something, you have to be aware of your own behavior. You have to be aware of how things work in your practice. And sometimes dealing with reality can be hard, like you said. It takes a lot
yeah,
of courage, because it needs confrontation, and it needs you to be vulnerable, to accept that things
yeah,
are not as well as you thought. But what happens is that sometimes you're just ignoring the problem.
yeah. Very good. That was a good one. Yes, that was a good one.
Thank you.
So I think that we should you should remind our listeners that we have a course about
Yeah.
all these things that we've been talking about. It's going to
Mm-hmm,
be
mm-hmm.
held in
Yeah. Go to softbites.online. The next edition is in October of
very
this year,
good.
in beautiful Sagres, in Algarve, in Portugal. And yeah, our course, it's a lot about this that we just discussed, about the self-awareness, the
Yeah.
communication, the tools for you to be able to create an healthy environment, and also, of course, the tools for you to be able to have a good system in place with
Hmm.
protocols, because these will really reduce a
Make
lot
a
of
difference.
the drama and in the dental
Yeah.
practice. If you know what to do in key situations, that's if you have a protocol in place for key situations, that and sometimes those situations look very it's the not
Not
important, but that
serious.
those
Yeah.
are the daily things that make a practice. So just go to
Absolutely.
Softbite Online and join us. Then join us.
All right. We'll be happy to see you there. Manuela, see you next time. Great to
See you
catch
next
up
time, George
again.
Andre. Thank you so much, and thank you for the ones listening.
Thank you. Bye
Bye
bye.
bye.